Okay, basically this part is dealing with, okay, you can see it's a part of what? Special phlebotomy procedures. Okay, special phlebotomy procedures are the following, like bleeding time testing, blood alcohol testing, blood donation testing, forensic testing, glucose testing, therapeutic phlebotomy, time specimen, and toxicology. So bleeding time. So bleeding time, okay. When we discuss about the blood cells, how many kinds of blood cells do we have? 3. Yes? What are they? Red blood cell, white blood cell, and platelets. Okay, these are the 3 kinds of cells. 3 kinds of blood cells. What are they? These are 1. Okay, red blood cells, or these are called erythrocytes. Erythrocytes. Okay, what is the number of erythrocytes? It ranges about 4.5 to 5.5 million per cubic millimeter. Okay, and then the next will be what? White blood cells. Yes, how do you call them? Lymphocytes are part of white blood. They are leukocytes. Okay, leukocytes. Yeah? So there are 5 kinds of leukocytes. What are they?
Eosinophils, basophils,
Monocytes, lymphocytes, and neutrophils. So these are the 5 kinds. Okay, we have the neutrophil, okay, and lymphocytes, okay, eosinophils, basophils, and monocytes. So these are the 5 kinds. Okay, these are the 5 kinds of white blood cells. The third ones are what we call platelets. What's the other name for platelets? Thrombocytes. Thrombocytes. Okay. How many are thrombocytes? These are usually 150 to 400,000 per cubic millimeter. Okay, and white blood cells are usually it can range also from 3,000, but let's write 5,000 to 12,000 per cubic millimeter. Okay, some values may change depending on the labs. Okay, but these are like the approximate values. Okay, so when we see all of them, the functions, what is the function of red blood cells? They carry oxygen and important nutrients, and they carry, for example, vitamin B12. They carry some important enzymes, proteins, heat, okay, in the body. So, and it circulates in the body. So that's very important. So the most important agent that carries oxygen is what we call hemoglobin. Okay, what about white blood cells? What is the function of white blood cells? They protect the body from infection and diseases. Okay, protect from infections and what? Diseases. Okay, so thrombocytes, they are important for what? For coagulation, blood clotting and coagulation. Okay, so these are basically the 3 most important blood cells. And so when we think of like blood clotting and coagulation, we think of what? Platelets. So here the first part is on bleeding time. Yeah, bleeding time and platelet function. So on bleeding time, so which cell are we going to consider? Red blood cells, white blood cells, or platelets? Platelets, yes. So platelets are important. Okay. Okay. So here there is a test, okay, to check the bleeding time. This is on the exam. Also, like the normal bleeding time is between what? 2.5 and 9.5 minutes. Okay, that is the normal. The maximum is like 15 minutes. Okay, it can prolong up to 15 minutes. So in this case, there are some steps of blood clot. That means when blood is clotting, there are some steps. Okay, the first one is there should be what? Let's say in order for the blood to clot, there should be what? A cut. Okay, there should be what? Bleeding first. Unless there is bleeding, there is no need to stop. So there should be what? An injury first. Yes. So at the site of injury, what will happen? First, the platelets, they go and they try to cover the area. Okay, so this is called a platelet plug formation. That means the platelets, they go and they try to cover what? The area. Okay, and then after this platelet plug formation, then there is what we call the coagulation cascade, or there are what we call coagulation factors, and these coagulation factors, they are being stimulated, so then coagulation cascade is initiated. Okay, the coagulation cascade is initiated. So just I will show you here what do you mean by coagulation cascade. If you see here, can you see this one here? So okay, it depends on what kind of injury it is. Okay, is the injury from outside or is that from inside of the body? So that we call it as extrinsic pathway and we call it intrinsic pathway. Extrinsic pathway means if there is a cut, for example, from outside. Intrinsic, if there is a bleeding from inside. Okay, so you have these two ways, and you can see here how these different factors, they are being what? They are being stimulated. Okay, you don't need to know all of this, but there are some important things. For example, when we deal of like coagulation, the prothrombin is important. For example, which test is important to detect prothrombin time? PT. Okay, PT or prothrombin time. For example, here important is PT or prothrombin time. Do you remember when you do? Anyone who remembers PT on your requisition? If you have the requisition, you can see PT and PTT. You remember that? Which tube do you select? Light blue. Okay, so PT, PTT, and D-dimer. These are all coagulation testing. For example, D-dimer is testing the last step, which is called this step here. Can you see this step? Fibrinogen to soluble fibrin and fibrin, and this is called fibrinolysis. Okay, at the end, the coagulation, the clot will form what we call fibrin, and that's because of fibrinogen, which is a coagulation agent. Okay, so D-dimer is testing the fibrinogen, because the fibrinogen will be converted to what we call fibrin, and you will see some fibrin, okay, on the bleeding area, on the clot area, and that fibrin will be changed again to FDP, which is called fibrin degradation product. It means it will be lysed and it will be degraded into some other products, and that's called fibrinolysis. So D-dimer is checking this step here. Okay, so what do you need for D-dimer? Which tube do you need? D-dimer. So all these three, they need which tube? PT, PTT, D-dimer, they need which tube? Light blue. Okay, so all like coagulation testing, PT, PTT, D-dimer, and also like factors, some factors like factor 8 here, which is called Willebrand factor, and factor 9, here factor 9, and factor 10, okay, they need what we call this light blue, so they are also under coagulation testing. because hemophilia factor, the Willebrand factor, Hagemann factor, Christmas factor. Okay, all of these, they have different names. Okay, so they need the light blue for testing. Okay, this is coagulation. Okay, after coagulation is what's happening is that there is fibrinolysis. That means that will be the final step where the coagulation is being done or the coagulation is being finished. Okay, so if you see the lists of conditions that prolong bleeding time, can you see them? There are like 1, 2, 3, 4, 5 of them. We have, for example, platelet disorders, okay, fibrinogen disorders, medications like aspirin, decreased platelet number, and scurvy. Okay, what do? They prolong. That means they prolong your bleeding time. What's scurvy? What do you mean by scurvy?
Vitamin C deficiency.
Yes, scurvy means vitamin C deficiency. That means vitamin C is important for blood clotting. Okay, so when you have, that's why sometimes you bleed. Yes, you'll have gum bleeding. Okay, gum bleeding will be when you have vitamin C deficiency. Yeah. So because vitamin C is important in the formation of collagen, that strengthens the blood vessels. So when we don't have vitamin C, then we'll have weak like blood vessels because of lack of collagen synthesis. So that will lead to certain bleedings in our skin or inside of our back of leg or on the gums. So that's why it's one of the reasons here. Okay, so how you do that is listed like here, the procedure of bleeding testing. Any questions? Okay.
Explain again what fibrin is.
Huh?
Fibrin.
Yeah.
So is that, so after coagulation, is fibrin what, like?
Yes.
The,
Fibrin are the small threads that they are formed because of fibrinogen. So fibrinogen is also a clotting factor. Okay. So this you see always in like protein study, anything that has ogen at the end. Can you see this term fibrin and ogen? Ogen means anything that is not active is called, like it ends with ogen. So fibrinogen is, okay, the inactive form of fibrin. When that fibrinogen is being activated, it will be converted to fibrin. Okay, so at the end you will have what? Fibrin on that bleeding area. Okay, so that's the product of like fibrinogen. So you know fibrinogen is found in the plasma. Yes. So earlier we said what? So if we say blood is made up of these cells, but in general blood is made up of what? Plasma and the cells. So the cells are these ones, yes? And plasma means, plasma is composed of proteins which are called albumin, globulin, and fibrinogen. These are important proteins that are found in the plasma. You know our plasma is, let's say for example, when you take green tube and if you centrifuge it, what will happen? You'll get the plasma on top and the blood will be settled down. That is the plasma. So in that plasma, there are these proteins. But if fibrinogen is missing in the plasma, it is called a serum. Okay, so basically serum means plasma without what? Fibrinogen. That means because fibrinogen is used for blood clotting, when blood clots, what will happen? The fibrinogen is what? Depleted. Yes? So you are left with serum. instead of plasma. Okay? So in any case, when the blood clots, that is when we are going to have the fibrinogen is being what? Used, and then you will have what? A serum. That's why in red tube, you see, if you see, that's the difference between red tube and that's the difference between red tube and green tube. So because in red tube or in any SST, like gold tube or tiger tube, for example, what is the additive inside? The additive is a clot activator. You see? Can you see? You can see clot activator. You can pass it. Clot activator. Okay? What does clot activator do? It activates the clotting, okay? It means it clots the blood. Okay, got it? So, if it activates the clotting, what will happen to the blood inside the red tube or gold or tiger tube? What will happen to the blood? It will clot, okay? It will clot. Then when you centrifuge, which one do you get, serum or plasma? No. In red tube, you get serum. Why? Because the blood already clots. You don't have fibrinogen. But in green tube, because the additive inside green tube is heparin, okay, it doesn't clot the blood. The blood will stay just fluid, okay? It will remain fluid. So when you centrifuge, you will get what? Okay. You will get what? You will get plasma. So that is the difference between the green serum versus plasma. So that means in green tubes, additive is what? Heparin. So centrifuge will plasma. So that is why these tubes, they are called plasma separator tubes. They are called plasma separator tubes or PST. But in case of serum tubes, like what? Like red, gold, or we call it tiger tube, the other the old name, but the new name is speckled tube. Speckled tube, okay? In this case, what is the additive? Clot activator. Okay? The additive is clot activator. And so, that is what are you getting? Serum, yes? So that's why it's called SST or serum separator tube, which is called SST. Okay? You get serum separator tube, which is SST.
So once the blood clots, the fibrinogen is converted.
It's already utilized. It's already depleted, so you don't have fibrinogen.
You have fiber.
And already there is fibrin on the clot. Okay, so the fibrinogen is not there.
Yeah.
So that means you no more have what? Plasma. So you have what? Serum instead. So that's why the serum tubes, when you you will have serum on top, but when you do green tubes, you will have plasma on top. Okay, that is the physiology of this. Okay, any questions? It's a good question. So let's not try that. Okay, page 40.